Doctor, if I told you that 1 in 4 of the patients you saw today had oral cancer, what would you do? You'd probably freak out and then make sure you screened them all and referred those at risk for testing. Why would you do that? Because it's life-threatening, and you're obligated to screen and identify at-risk patients in order to save their lives. You're a healthcare provider, and doing right by your patients is paramount. Now, what if I told you that 1 in 4 of the adult patients you see today actually does have a condition that, if left untreated, could threaten their life and debilitate their quality of life, just like cancer? That's a lot of people. Did you know that the ADA has recently released guidance advising all dentists to screen for this? You're still a healthcare provider and still obligated to do right by your patients. The disease I'm talking about is sleep-disordered breathing, sometimes called snoring, upper airway resistance syndrome, or obstructive sleep apnea. As a dental professional, you see these problems daily in your patients. Patients who snore, have high blood pressure, suffer from morning headaches, acid reflux, they clench or brux, they have really active mobile tongues, they have type 2 diabetes, large necks, and those with excessive daytime tiredness, and that does include falling asleep in your dental chair or waiting room. The good news is that you can do something about it. You can put them on the right path, get them diagnosed, and provide life-saving therapy with oral appliances. You want to know the best part? Oral appliances are an approved first-line therapy for sleep apnea. And when given the choice, patients greatly prefer them over CPAP or surgical options. And despite what you may have heard or even experienced, when a correct protocol is followed, insurance absolutely does pay for this and pays well. The fact is that most dentists are unknowingly sitting on over $500,000 in sleep revenue just within your existing patient base. So how do you unlock this potential? Where do you go to empower and educate your entire team to bring this new business to life? There are more choices now than ever, and unfortunately, many courses or training programs give you one piece of a very complex puzzle, leaving you on your own to figure out the rest. It would be like buying handlebars or tires for a bike, but missing the seat and the frame. You're not going to get very far with just that. Sleep Group Solutions is different. We provide the entire system. Not only do we provide the full system, but we hold your hand through the process of team education and training, administrative and clinical records, instrumentation, physician networking. We have physicians, MDs, willing to work with you. Medical insurance billing and reimbursement. The fact is, there's never been a better time than right now to get started with dental sleep medicine. Patient awareness is at an all-time high. Think of all the advertisements you've seen for sleep therapy, mattress systems, CPAPs, and CPAP cleaners. This year, people spent over $30 billion on sleep alone, and oral appliances are part of that market. Remember, doctor, 1 in 4 of your adult patients today likely has an undiagnosed sleep-related breathing problem. Just think, if you find just one of them and start them down the correct path in your practice, only half of those move forward with treatment, you'll still save dozens of lives your first year. Save even more marriages. Provide quality of life back to your patients and their families affected by their condition, all while adding $30,000 to $40,000 a month in revenue to your practice. How's that sound? Speaking of quality of life, what about yours? Are you at a point in your career where you'd like to be paid well for being a healthcare provider instead of being paid for production? Are you interested in leveraging your team's time to produce for the practice and freeing up more of your time to focus on what matters most to you? Dental sleep medicine may be your solution, and Sleep Group Solutions is here to help make it happen for you. Our mission is to ensure that you are wildly successful both clinically and financially with sleep. This is all we've done for nearly 20 years. Your next step is to schedule a call with a dental sleep medicine expert. We'd like to chat and learn a bit more about you, about your practice and your patients and your sleep medicine goals. This is the first step to putting you on a path to make your sleep dreams a reality. Schedule a meeting now or join us live at a Discover Dental Sleep Medicine training event near you.